All right, so we are coming up at noon. And so we just want to give everyone a few minutes to settle in. We certainly have a wonderful response to today's rally. So it might take a minute or so, but we are going to start on time at noon. So just sit tight, get a drink, and we will be back in about a minute. Thank you. Okay, so it is 1 minute after 12. I'm sure people will keep filing in, but we're going to go ahead and get started in the interest of respecting everybody's time. So good afternoon, everyone. Thank you for joining us for today's Jews and Allies Abortion Rights virtual rally. I am Jennifer Kryshka, CEO of the Jewish Women's Foundation of the Greater Palm Beaches. And our mission is to create long-lasting social change to advance the status of all women and girls in the United States and in Israel. And we are so excited to be hosting today's rally. In the coming months, we do intend to hold additional rallies in person because I know that we're all very fired up about what's going on, and we all know what's at stake when women are not in control of their own bodies. I want to give a very, very big thanks to all of our organizers for today, Linda Geller-Schwartz, Tara Laxer, Meredith Ockman, and Judith Selzer. I'm sure many of you will have lots of questions, but we have 350 plus people who have signed up for today's rally. So for logistical reasons, that makes it difficult to be able to get to lots of questions. If there is any time at the end, we will try to take a few questions, and those should be submitted not through the chat feature, but through the Q&A feature. So I'm going to go ahead and turn this over to Linda Geller-Schwartz, who is today's moderator. So thank you, Linda.
Thank you, Jennifer. Good afternoon, everyone. I'm Linda Geller-Schwartz, Chair at South Florida Zionesses, which is one of the co-sponsors of this virtual rally. We're going to start today by briefly introducing all our wonderful speakers. I have the pleasure of introducing State Senator Lori Berman. Senator Berman is a real champion of women's rights. Before becoming state senator for District 31, Lori served for 7 years in the Florida House of Representatives. She has a strong record of standing up for a women's right to choose, pushing for common sense gun violence prevention measures, advocating for traditional public schools, expanding access to high quality healthcare, and fighting for seniors. This coming session, she has announced that she will be filing a bill that would not only repeal the recently passed 15-week abortion ban, but would also codify the right to an abortion based on the strong right to privacy in the Florida Constitution. Thank you so much for joining us, Senator Berman. Meredith?
Hi, I'm Meredith Ockman. I am Vice President of Palm Beach County Human Rights Council, which is also a sponsor of the event, and formerly of NOW. I'm also a clinic escort for approximately 19 years, and I am pleased to introduce my friend Mona Reis of Presidential Women's Center. Mona's career has spanned over 3 decades of providing direct reproductive care to women in Palm Beach County. She's been on the front lines of attacks, both personally and professionally, fighting the attacks from the conservatives, the terrorists, the religious right. Mona has recently retired from the helm of Presidential Women's Center and continues her advisory role. Mona's expertise reaches the national and international fight to save women's lives every day. Thank you for being with us, Mona. Tara? You're on mute.
Good afternoon. I'm Tara Laxer, and it's my honor to introduce Rabbi Rachel Greengrass, who serves at the Congregation of Temple Beth Em in Miami. Rabbi Greengrass was ordained in 2008 from Hebrew Union College Jewish Institute of Religion's New York campus. She's held several leadership roles in the Jewish community, including being a Rabbi Without Borders Fellow and the president of the Rabbinical Association of Greater Miami. She's very active in the RAC, which is the Religious Action Center of Reform Judaism, where she spearheaded and worked very hard on issues ranging from immigration justice to voting rights. There and throughout the community, she has demonstrated her deep commitment to the Jewish community and the entire community at large and to social justice. We can't thank her enough for being here today. Thank you, Rabbi.
Okay, and I am going to introduce Amy Weintraub. So she is the Reproductive Rights Program Director at Progress, Florida, to talk about statewide efforts to protect reproductive freedom and abortion access. Amy has extensive experience advocating for reproductive rights, women's and social change issues, and she is responsible for a very valuable weekly roundup on everything that happens in the state and nationally on reproductive rights. Amy, thank you so much for joining us. And now I'm turning it back to Linda.
Thanks, Jennifer. So let's get right to the questions from our extremely knowledgeable panel. As many on this call may know, of all the US religious groups, Jews are the most in favor of abortion rights. A 2014 Pew Research poll found that a full 83% of American Jews believe that abortion should be legal in all or most cases. And a 2022 national survey of Jewish voters found that 75% of Jews expressed concern that the Supreme Court would overturn Roe v. Wade. No one knows what the final decision of the Supreme Court will be on Roe v. Wade, but we are all very worried about the impact it will have on an individual's access to reproductive health and specifically abortions in Florida. Could each of you take just 4 or 5 minutes to give us your thoughts on how you see the current situation and what you think we can anticipate in Florida, particularly if what we fear, namely the overturning of Roe v. Wade, actually comes to pass? Senator Berman, could you start, please?
Thank you so much, and thank you for putting this panel together. And I'm thrilled to be here with these illustrious other panelists, and happy to see so many people have signed up and are listening to the panel. And I think it's a reflection of how we all feel. And I'm going to give you the perspective of the Florida politician. And we have other great perspectives on here today. So as you know, Florida had, well, as you may or may not know, Florida actually in the 1970s passed our own privacy provision in our Constitution. It's very strong. And it says that everybody has the right to live their lives with privacy. And that provision was interpreted by the court in a famous case to allow abortions. And we've relied heavily on that whenever there have been challenges to abortions. I've been in the legislature now for 12 years. I've seen a multitude of attacks on abortion rights. And basically, they've been from the 24-hour waiting period to what they call trap regulations, which says that abortion providers have to go well above and beyond any other medical provider in terms of their facilities and what they do. We did the ultrasound bill, and a lot of them we challenged based on this privacy right. And at the time, we were very much like we had a court that often sided and said, yes, you're right, those things violate privacy rights. Since then, just like the US Supreme Court composition has changed, the composition of the Florida Supreme Court has changed. And recently they said that the 24-hour ban is, the 24-hour waiting period is appropriate, and they have put it back into the law. So I don't think we can count on the courts as much in the future. So what we did this past legislative session was by far the most restrictive abortion ban that we've done. And we did a 15-week abortion ban. So after 15 weeks in the state of Florida, you are almost, in most cases, the vast majority of cases, prohibited from doing an abortion. There is one exception if the life of the woman is at stake and if the child will not be able to live outside the womb. Very hard decisions to make. Those are not clear-cut, easy answers for a doctor to do this. And a doctor who violates this is obviously subject to breaking the law. So it's going to be, doctors are going to be very reluctant to do this. You know, and people talk about, oh, 15 weeks, maybe it's moderate. It's not moderate. You have to recognize who the people are who are having the abortions after 15 weeks. You've got young kids who don't even know they're pregnant. You've got people who don't have money, who are saving money for an abortion. And then you have people who have a real medical issue where you can't even get an amnio until 16 weeks. They don't even know, you know, you don't find out the problems. And unless it's a life-threatening illness, you will be required to have that child. And I will tell you, as a example of how far and how horrible this bill is, we put in an exception for, we put an amendment for an exception for rape or incest. And one of our members got up there and did the most heartfelt speech and talked about how she was raped as a child in a group setting, and said, please don't make these people have to have their babies. And they wouldn't even do that exception. So there's no changing, and not only that, not even one person came and voted with us. So there is no changing the Florida legislature. It is very much not going to be in favor of doing anything that would codify Roe or even, you know, make sure that women have the right to have an abortion. Now, there's been a lot of discussion about whether Florida is going to go further than this 15-week abortion ban. The governor's been pretty silent since Roe, and I think that there are a lot of women who are concerned. And so I think that they're kind of doing polling and figuring out if they can go further. My thought, and it's just my thought as a legislator, but having been there for 12 years, I kind of feel like I have a little feel on the pulse, is that it won't happen before November. There won't be anything done on abortion before November. You know, could happen. We're having a special session next week. But, you know, I don't think it'll happen, but stay tuned, because this is Florida and anything can happen. And you could see a 6-week ban, you could see an outright ban. So I hit my time limit, and I'm happy to, you know, be on here and answer questions. And I think we have another question coming. So thank you.
Thanks very much, Senator Berman. Rabbi Greengrass, can you give us your views on this?
Yes, thank you. Thank you so much. And thank you for hosting this. I want to share, you know, Senator Berman just talked about the 15-week abortion ban. I want to share 2 stories with permission of the couples who they represent. The first is 2 of my colleagues. When I was at HUC in New York studying to be a rabbi, he was studying to be a rabbi and his wife was studying to be a cantor. They very much were so excited to have a baby. He was reading to her bump every night. She was singing to it. And then they found out late in the 2nd trimester that the fetus had no brain function. And obviously they were both devastated, but she continued to be traumatized every day as people would touch her stomach and ask her how long until the baby was born. Had she been here in Florida, she would have had to carry this dead fetus to term. And luckily she was in New York at the time. Here in Miami, I did have a couple friends of mine who are very vocal now, who also wanted to have a child and found out that the fetus they were carrying had Tay-Sachs disease. Again, a hard choice. I share both of these stories, not because these are the only situations in which abortion is okay, but that is not true at all, just to show that this is a very personal decision. And it can be a very heartbreaking decision. And it shouldn't be one where an individual or a couple feels that they have to defend themselves or be judged by other people about making this choice, which is their healthcare choice. In Judaism, this is also a religious issue. Now, most of us are used to hearing what the religious right says. And the religious right has decided to define life as conception. But in Judaism, life is defined at birth. And in fact, the mitzvah of being fruitful and multiply doesn't even fall upon women. There's this incredible story in the Talmud in Yevamot where Rabbi Chia's wife has very painful births. And so she dresses up so her husband doesn't recognize her, as her husband's the halachic authority. He's like the judge, and of the area. And she stands before him and says, "Is a woman commanded to be fruitful and multiply?" And he says, "No." And she drinks this potion that makes it so that she can no longer have children. So we see right there in the Talmud that one, women are not obligated to be fruitful and multiply. It is not a choice that a man can make for us. It is very much a woman's choice, whether or not and when and how she has children. When it comes to abortion, the most often cited text is right from Exodus. In Exodus chapter 21, we hear that when we see a scene where two men are striving together and one accidentally hits a pregnant woman and she miscarries. And it says that he's fined. So the fetus has some sort of value, but it continues by saying, if the woman is injured, then it's eye for eye, tooth for tooth, leg for leg. So very big distinction between the life of the woman and the value of the woman's life and the life of this potential life of the fetus. That being said, we fall very differently. Different people within the rabbinic community look at the same text and may fall on different levels of the spectrum of when and where is abortion acceptable, and when and where and how can we use birth control. But all rabbis use the same text from which to base this. And there's two things that we need to keep in mind, which is that the halachic status of an embryo or fetus changes throughout its development. From conception to the 40th day, it's considered mere water. That's from Yevamot 69. And then from that point on, it's considered to be a limb of the mother, right? And our limbs have value. Of course they do. But there might be a reason that we need to get rid of a limb. And then it differs by different halachic sources. Everybody agrees if the woman's life is in physical danger, that her life takes precedence over the potential life of the fetus, to the point that the Talmud even says if she's having trouble giving birth, that you cut up the embryo in utero and take it out. However, there is debate on where we draw the line in terms of mental anguish. So for example, the living have precedence over this potential life. So there's two things for us to think about when there is a pregnancy that is unwanted. One, how is this going to affect a woman physically and emotionally? How will this affect maybe the children she already has physically and emotionally, the person that she's partnered with, and where, how can we make sure that she has the health care that she needs? And that's another point that I want to make. Hopefully I'll have more time later, but in Judaism, we very, very much care about healthcare. And the Talmud says, no matter what you can afford, you cannot turn away people from receiving healthcare. And when you ask, what is this, what do I think is going to happen? I think that this is also going to trample on women's rights to healthcare, not just surgical abortions, but Plan B and other forms of birth control. So thank you so much.
Thank you so much, Rabbi. Sorry we want to get everything in the time, but it was very helpful. Could we turn to Mona Reis now, please?
Hi, everybody. I also want to thank all the organizers of this. There's no doubt this is very timely and very important. And I also want to give a shout out to my daughter, Rachel Needle, who I know is on this call, who has been part of this journey since she was 2 years old. And I know how much this means to her as well. I'm the oldest person on this panel. And I say this because I grew up in the late 60s and early 70s and can remember quite clearly the stories of my friends risking their lives to obtain an illegal abortion. A few left the country, a few met people on street corners, got into strange cars, they were blindfolded, dropped off at a strange place, and large sums of cash were quickly taken from them. They were scared, they prayed that they would make it out alive. Many did, thanks to physicians who were willing to risk their lives for what they believed in. Unfortunately, many women were never able to have children due to severe complications from illegal abortion. And as many of you know, we are living this reality. And even though we were chanting and wearing shirts that said we vowed we would never go back again, we are clearly at this point. In 1971, while attending school in Washington, D.C., I lobbied for legalized abortion. When I graduated school a little early, not because I was smart, I went to summer school. I was hired as a counselor the day after Roe by the University of Miami School of Medicine. And I fell in love with the work, particularly the patients who gave me a special window into their hearts, their lives, allowing me to encourage their strength and validate their goals and dreams and hold their hands with kindness and support as they went through an abortion procedure that would change their lives forever. At that time, and it's important to mention this, there were no parental consent laws for minors and Medicaid paid for abortions. In 1976, I opened the first abortion clinic in Palm Beach County for a man who owned a clinic in Miami. And in 1980, with a $50,000 loan from a bank that required my then husband's signature, I opened Presidential Women's Center, which was on Presidential Way. I had just turned 29 years old, but knew that I wanted to help women with a feminist model of healthcare delivery. I can actually remember our very first patient. She had taken the bus from Belgrade. She had 4 young children at home. We reduced her fee, and I remember that she sobbed in my arms with gratitude. Fast forward 41 years, the center which I founded has helped thousands of women, each with their own unique story. However, they are now forced to navigate burdensome laws and regulations that have created challenges and frustrations in their ability to access care. As Senator Berman so eloquently discussed the laws in Florida, I want to explain the impact that they have on patients. Although we have both a parental notification and consent for minors with a judicial bypass option, it is not only difficult for teens to access the court system, but in many counties, the judges make the experience very intimidating by asking personal and often embarrassing questions. Many lawsuits have been filed with judges who have refused to grant the bypass. More than 80% of the patients from Presidential Women's Center receive financial assistance thanks to EMA and the National Abortion Federation Justice Department program. These funds often include payment for transportation, hotels, gas, and food, especially for patients who are coming from other southern states which ban abortions in the second trimester. Patients are now required to abide by the mandatory 24-hour waiting period, which requires a physician in person to go over the informed consent form, but we all know the real reason as to why the state has forced us to implement these laws. They hope that women will change their minds. A complete insult and direct disrespect for thinking that women have not already given this tremendous thought. But it also places an undue burden on them to take extra days off from work, arrange childcare for an extra day, and possible transportation problems. There is also a mandatory ultrasound law. And unlike other states, obtaining mifepristone, the abortion pill, cannot be done by telehealth and mailed to the patients. When different states allow women to be able to do this, especially in rural areas, to safely be able to receive the pill in the mail, many women's lives are saved, because otherwise it's a 400 to 500 mile trip to the nearest clinic. And then there are mandatory admitting privileges and hospital transport agreements. Many counties only have Catholic hospitals in the areas, and they refuse to grant a transport agreement. And by the way, this is not required by urgent care centers and other medical facilities. The 15-week ban will go into effect, sadly, on July 1st, and I do hope that this will be successfully challenged. This will immediately create significant barriers for women. More than 5,000 women terminate a pregnancy after 15 weeks in Florida. Often these patients have very wanted pregnancies, which have very adequately been explained by Lori and Rabbi Greengrass, so I won't go into that. But it also makes it, creates a situation, especially for young people. And one particular situation that I want to talk about is 4 years ago, we saw a 12-year-old girl who was impregnated by her father. She was in foster care at the time they found out she was 22 weeks in the pregnancy. I'm happy to say that we cared for this patient and that we were also part of the prosecution that put the man away for life. And we also kept in touch with her and saw this wonderful young girl adopted, become a straight A student with plans to go to college and become a doctor. I shudder to think about the many stories that we will hear as we will now be forced to assist women in whatever it takes to go out of state for abortion care. This has become our new reality. Obtaining a safe and legal abortion will depend on your financial ability to pay for it and what zip code you live in. Thank you.
Thank you so much, Mona. I'm just going to have to take something from the chat. Someone wrote, "Thank you for your years of advocacy and tremendous courage." Thank you so much, Mona. Not just for your remarks today, but for the 41 years.
Thank you.
Can we turn to Amy now?
Oh, thank you so much, Linda. And thanks for having and leading this courageous conversation as we all are collectively trying to figure out what our post-Roe world is going to look like. And I'd like to send a shout out like Mona did to her daughter, to my young adult son, Jeremiah Weintraub, who's listening on this Zoom today. You all know that male allies are such a critical part of our movement. And so let's continue pulling in our husbands and our sons, our grandsons, our nephews, and male rabbis into our work. There are a couple of things that let me sleep at night instead of obsessing. I do a lot of obsessing about Roe, but I do sleep. And here are the reasons that I do. Even if Roe is overturned, one thing that I anticipate, one thing that I know is that our dedicated Florida healthcare providers are going to go to great lengths to make sure that patients get the care that they need. And that is no matter if we're talking about July 1st and that patient who is now past the 15-week mark in their pregnancy, or if we're talking about a time in the future when our, hostile majority in the legislature decides to pass a law banning abortion altogether. Our healthcare providers will persevere. And you all may have seen the piece written in the Paradise Progressive. It's a great blog out of Southwest Florida. And they reported on December remarks by Planned Parenthood of Southwest and Central Florida, Stephanie Frame, who said, and I'm going to quote her, "We are at the beginning stages of building one of the largest patient navigation systems in the state, connecting it to one of the largest patient navigation systems in the country," end quote. So Planned Parenthood, just like our amazing independent abortion clinics throughout the state and Florida abortion funds, are building teams, state, national teams to help patients get to the healthcare services that they need, even if that means getting them out of state. And as an additional option, Stephanie Frame talks about getting a boat that would be anchored off the east coast of Florida. And they seriously are talking about it. And she describes how this boat would legally provide abortions on the boat in international waters. She says she's already being contacted by pilots who have float planes who could ferry those patients out to any vessel. And whether this really happens or it doesn't, it's this type of thinking that gives me a certain level of peace. And secondly, the fact is that people now have options. Thank you to science and technology and research that like international telehealth that we simply didn't have in the pre-Roe years. And you all know that during that time, up to 5,000 American women died every year from poor abortion care. But like so many other drugs, abortion pills are now being acquired from overseas medical practices and overseas pharmacies and shipped to American homes. These pills, and we're talking about mifepristone and misoprostol or combination of them, are safer than Viagra. They're safer than penicillin, even safer than Tylenol. And they are effective at ending pregnancy. Of course, these are what are used in our at abortion providers across the state now. And even if legislatures in some states are going to ban American doctors and pharmacies from dispensing them, Americans will use creative approaches to getting these pills. Heck, they already are. Tens of thousands of packets are flowing into American homes every day and through our mail system to people who already are having difficulty accessing abortion care in their communities because they don't have the money, because there's a lack of providers in their community, because of privacy concerns, and a whole host of other reasons. Many partners in our movement, including Progress Florida, where I work, are working to make sure that accurate information and reliable support are out there so that for anyone who wants to explore that option of self-managing their own abortion using these drugs.
Thank you, Amy, very much. I must say that, you know, I've been reading the chat. We're going through various moods here of depression and uplifting. And someone just wrote, this is the most uplifting group of professionals. I now have hope and will continue to persevere, which turns us to our next question, because the questions we've had so far mostly rest on the single point. What can we do? What is our plan of action? And you've talked about some of this, Amy, but I'd like to give everybody the opportunity to take 3 or 4 minutes, whatever time they need, to give us what you're thinking about. Where do we go from here? I mean, all of us are very concerned about the situation of reproductive rights and abortion, but we come at it from different perspectives too. Some of us are particularly concerned because we have a deep sense of injustice about the threat to women's equality. Others are particularly upset about this blatant incursion on religious freedom. Others are particularly troubled, and we haven't talked about this too much, by the serious social justice implications, particularly on those who are the most vulnerable among us. So what can we do? What are the couple of things you'd like to suggest, actions that perhaps each of us as individuals can take to fight back against the situation and where we're going? Okay, Lori, would you mind starting? Thank you.
Sure. Thank you so much. And I love everybody's comments. And it's just so important that we're having this discussion. So of course, I'm the politician. So you're going to hear me talk about what we can do from a political point of view. And the biggest thing you can do is vote. We all know that. And the second biggest thing you can do is get other people to vote and get people registered to vote. Talk to all your friends, your neighbors. If you're on this call, I'm sure you're a regular voter, what we call a super voter. But maybe your brother, your sister is not a super voter. So you've got to get to them to vote. You've got to research the candidates. You've got to know the issues. You've got to know, and over the years, the anti-abortion advocates have been single issue voters, and maybe it's time we become single issue voters, and that you don't vote for any candidate if they do not support abortion rights. That's just your litmus test, and you make sure that you follow through on that. We had 2 rallies on Saturday in Palm Beach County, one in Delray, one in West Palm Beach. And going to rallies is fantastic. Don't let anybody tell you that it's futile and it's a waste of time and it doesn't have an impact. It has an impact. People are watching. And like I said, the governor's office, I think, is being very circumspect because they're watching. And if there's not a big response, a big turnout, they will go further. But when they see that there's a big response, that people are going to rallies and people are really getting excited, it pulls them back from going further, which so go to rallies, be out there. If you're able to, write an op-ed and put it in the newspaper. I mean, get your voice out, because we know that they are watching. And that's the best thing that you can actually do, is let them know that this is not acceptable. Like, you know, as we say, we're not going back. Unfortunately, things are not moving forward the way we want them to be. And we might take a little bit backwards, but we're going to push to make sure that we continue to go forward all the time. So those are the best things that I can tell you to do. I'm sure you're going to hear some other great ideas from the other panelists, but from a political point of view, go to rallies, write op-eds, vote, and get other people to vote, and be a single issue voter on this issue.
Thanks, Senator Berman. Rabbi Greengrass.
I would add that when you're writing those op-eds and when you're protesting, like, know that you're doing holy work. You are doing something to provide healthcare access for women. You are doing something to save lives. Don't let somebody else's definition of what is religious fall upon you. And that's what's really happening with this. This is, you know, this is the white male Christian patriarchy projecting their opinions onto women's bodies. So know that you're doing holy work, know that you are doing religious work, and that this work is not just for you, obviously, and your rights, but as has been held up when we talk about social justice issues, who is this most likely to affect? It is most likely to affect women who do not have financial means, women who are in unhealthy situations. And it is a social justice issue for us to make sure that this is provided not just for wealthy women of means, but for all women who need health care. So, you know, God bless you in your work.
Thank you, Rabbi Greengrass. Mona?
So I'm going to start with apologizing. After I talked to Lori yesterday, I recognized that everything that I was going to say, she was going to say, and she was going to speak first. So I would have nothing to say other than, or to add, other than to support your local abortion fund. So what I decided to do was, I wanted to take the time, and I hope it's okay with everyone, to explain a little bit of the reality of the leaked SCOTUS decision from 8 days ago, and give you a few scenarios, because I do think it's important, because all of you on this call today are ambassadors of truth. And because we are living in scary times, it's important that everywhere you go that you articulate this reality. I'm not going to delve into the specific arguments in favor of overturning Roe that are discussed in the opinion, but what I will say is that the draft opinion represents the most extreme version of arguments that the anti-abortion extremists have put forward in years. It not only upholds Mississippi's 15-week ban, but it goes much further and allows states to completely ban abortion. It almost completely ignores pregnant people's rights to self-determination and autonomy. And in addition, the opinion creates a roadmap for dismantling other constitutional rights that are inextricably linked to the right to abortion, including the right to contraception, the right to marry a person of a different race or sex, and the right to sexual intimacy, etc. The draft opinion claims that those other liberty rights are not implicated because only abortion involves potential life. But the exact same reasoning applies with equal force. None of those other rights are specified in the Constitution or deeply rooted in our nation's history and tradition. The final, sorry, are you there? The final sorry, but the exact same reasoning applies with equal force. None of these rights are specified in the Constitution. The final opinion could end up using softer language, including the possibility that we could see an opinion upholding the Mississippi's 15-week ban without the court explicitly saying that Roe is overturned. In that scenario, depending on how the opinion is written, we might be able to stave off earlier bans, at least in the short term. But if that's the case, the opinion will create a lot of harm, confusion, and chaos, and will make it difficult to know what is legal and illegal across the country. Regardless of the final language of the opinion, we need to make sure that people understand now the devastating impact. So I want to emphasize, unequivocally charge all of you to continue to talk about this and to also inform others that elections have consequences and that they must vote, as we have said, for pro-choice candidates, and not those who say they are pro-choice and then vote against codifying Roe. But they also understand that presidents, governors, and senators nominate and confirm federal judges who are appointed for life. We are in the fight of our lives. And I hope that we have the power to make some changes. Thank you.
Thank you, Mona, for contributing that. Amy.
All right, y'all, abortion funds throughout Florida really, really need our support. And it's just not for money to go to cover people's, the costs associated with the procedure or the medication, but it's also to help with things like gas and airline travel for people past 15 weeks, starting July 1st, for Uber rides, for hotels, for childcare. And also some of these funds are seeking volunteers to help drive clients to appointments and help get travel itineraries together and order airplane tickets and to make hotel reservations and to provide childcare while mom is getting a procedure done. And you can find all of the abortion funds on the website of the Floridians for Reproductive Freedom Coalition. And I'm going to put that in chat. I just stuck it in chat now. That coalition is also known as FRF, Floridians for Reproductive Freedom. The other thing I ask you to do is to get familiar with and help spread the word about self-managed abortion that is safe and supported. Progress Florida offers Train the Trainer workshops every month to help folks learn how to share information legally and keep themselves out of trouble. And it's about and share information about accessing and safely using abortion pills outside the traditional medical setting. And our next trainings are on June 6th and July 21st, and you'll find registration information on the Take Action section of the FRF website, which I had just linked in chat. Also, you can sign up for our for the weekly newsletter that comes out every Friday morning that I edit. And it really is a compilation of statewide news, including all these events that are going to be happening before the Supreme Court decisions announced and after. And it's so important, like others have said, to attend, make sure those events are populated, not only by attending, but by sharing information on your social media feeds, your personal and your organizational feeds. And you can sign up for that newsletter by clicking on Join Us at that FRF website. And I'll put that in chat again, just in case anyone missed it.
Thank you, Amy. Let me just say it's an excellent newsletter and everybody should try and subscribe to it, or at least sign up for it. Unless one of the panelists would like to respond to anything anybody else said on the panel, I'll ask a few of the questions we have. Yes, Lori?
Listening to that made me also remember something that I want all of us to do, all of us to talk about, and that is we need to use the word abortion. I think somebody wrote it in the chat room. Use that word. Don't be afraid of using that word. It's a powerful word and it's what we're doing. And if you feel comfortable and if you've had an abortion, talk about it and tell people. We have to destigmatize the whole issue. So as much as you feel comfortable about it, if 1 in 4 women have had abortions, so lots of people have had them, talk about it and talk about abortion, and it needs to be in a manner where people understand that it is healthcare and that we can talk about it for that reason.
Thank you. Anything else? We've got a few specific questions in the chat and then some more general ones. Let me pick up a couple that maybe Amy would like to take. Tell me more about the abortion drugs. Are they safe through 40 weeks? Can you give us a little information?
Great question. The World Health Organization says that they are safe up to 12 weeks of pregnancy. 12 weeks of pregnancy. They are safe during that time. The farther along, the closer to that 12-week mark, the more challenging the experience is. So accessing the medication earlier is easier.
Thank you. There's another question I'll have for you. Federal versus state. Medicaid is state, Medicare is federal. How will this affect healthcare? A little bit general, but maybe you can.
Medicaid, I think they meant Medicaid. Medicaid, there are a few states that offer Medicaid coverage of abortion. Florida is not one, so it will have no impact on Floridians who depend on Medicaid for insurance. So does that answer the question, Linda?
Yeah, well, it was a little general, but I think they were, the point you're making is well taken in Florida. It's unfortunately pretty moot, so. Rabbi Greengrass, there are a couple of questions that maybe you could answer. We were asking for quick, no, that was the one, sorry, just a second. In your experience, Rabbi, do most Orthodox rabbis view abortion with a more conservative viewpoint? Maybe you can explain, because this is Jews and Allies, so I imagine there are a number of people on the call who are querying this and wondering about it.
Yeah, so there's, when it comes to abortion in particular, and actually in birth control in general, I have so many texts on this. I actually wrote my thesis about rabbinic approaches to birth control, so it's hard for me to limit myself.
Go ahead.
So there's, in the Talmud, it talks about 3 women who use birth control. A minor, a pregnant woman, and a nursing woman. The minor for her own health, the pregnant woman the pregnant woman for the baby already in the womb. They're imagining that you might have 2 rooms, which is something that actually happens, and the nursing woman for the living child. So there's some rabbis who follow Rashi who understand that these 3 women may use birth control, but others may not. Rabbi Tam says these 3 women have to use birth control and everybody else can. So that's really like where the birth control debate stems from. So this is around 1040 that we're talking about. And then when it comes to abortion, Moses Maimonides wrote that you can look at the fetus in the womb as a pursuer, like posing a threat to the mother's life. And there are laws that if someone is pursuing you in the Talmud that you're allowed to kill that person. So Maimonides originally meant this as one instance within which abortion is okay, not a limiting to only this instance. But what happens is some of my Orthodox colleagues read this as limiting it, and it's only when the woman's life is in danger. I like to always pull back and just look at the big picture and say, we are all in agreement that the woman's life has precedence and that there are instances where abortion is called for. That makes us all pro-choice, the way that it's being defined right now politically.
Okay, that's helpful. Thank you. There was another question that I'm going to put to you, Rabbi. We are asking for Christian white men to keep their hands off our reproductive rights. How are we as Jewish women supposed to get them to change their stances? That's a good one.
This is really hard. I think if we knew, we'd be doing it. I do think, first of all, being loud, being vocal, recognizing the power that we all have when we stand together, not trying to be polite, and, not worrying about male fragility. And I also think working with our allies, allies who are also like challenging this narrative that men should be able to control everything that happens. Other women, people of color, and other religious minorities, just saying that this dominant narrative, because it's dominant doesn't make it the only narrative nor the correct one.
That's why this call is Jews and Allies. We all have to work on this.
I love it.
Thank you. Maybe Senator Berman, you can take this one. from Michelle Litt. Should we expect Republican federal legislation pushback on what can be sent through the mail from abroad if abortion is illegal in some states? Or maybe Amy.
Yeah, certainly, that really depends on the makeup of the next Congress. Right now, there's not enough votes to push something like that through, but there's unquestionably, that's what Mona just explained about the actual wording of the opinion, is it can be used to stop access to contraceptions even. So if you're going to have stop access to contraceptions, you're certainly going to stop access to abortion pills. But it all depends on the makeup of the legislatures, and the same with the Florida legislature. I mean, the Florida legislature could do the same kind of thing, prohibit importation of the pills. So that's why it's important what I said, you've got to vote and you've got to put the people in the legislature, because otherwise you could see some of these draconian measures coming through.
Linda, may I add something there?
Yes, please.
I just would say that no matter what laws are passed about abortion pills, Americans are still going to access these pills online. And even if their state legislature bans it. And that means that, they're going to be at legal risk. I mean, actually Floridians are already at legal risk because, technically to get an abortion in Florida, there must be an ultrasound and there must be a doctor involved, but the risk is minimal. Only fewer than 30 women have ever been arrested in the United States in the 30 plus years that these drugs have been available. But there is risk, and those who are most at risk of those who are already over policed, and that is Black women and low income women. So in our training, I just say we offer suggestions about how to mitigate that risk and how to actually mitigate the risk of us even sharing information. But I don't want to, people are going to get it, no matter, they're going to try to get it, they're going to successfully get it no matter what happens, but there are things we can do to make them more secure legally.
Thank you. I've got one more question for you that is interesting here. I like the idea of boats in international waters. However, some states want to punish women who leave their state to access an abortion and doctors who perform an abortion. If the boat is in international waters, is it subject to a state law when the woman and the doctor return to their state?
I mean, anyone can sue anyone for anything. So potentially she would be sued. I mean, in Texas, it's going to be in civil court, not in criminal court. The antis are going to do whatever they can to stigmatize and shame us from getting the care that we need. But who is actually going to prosecute? You've got all kinds of local prosecutors in these bad states who are saying they won't prosecute, and we've got to hang our hat on those folks. And I do think all in all, in the aggregate, the risk is small that people will be criminalized for their pregnancy outcomes, but it is there.
Thank you. We have a lot more in the chat, but we don't have very much more time. I'm going to give one more question for Mona. Could you talk about, again, how we can help providers? Because in the current context, that's other than voting, it seems to be one of the really important things among others that we can do.
I'm really happy that you brought that up because, and I should have discussed this, the impact of complying with these laws, especially this 24-hour waiting period, has been a nightmare. Many clinics, like Presidential, we only have physicians there 3 days a week. They have their private practices. So to see the patients that we see for services, the actual abortion, and then having to see the same patients on top of that has just been really wearing on the staff. So here's what I'm going to say. So there are two things. One, no matter where you live, independent providers could use, I think, some love. So whether or not you decide to send a platter of cookies, a little note, just something to be encouraging and supportive, I think means so much to those that are working every day, providing care for patients and going over and beyond to help with a lot of the challenges that the patients are dealing with. The other part of this is to also support, well, in Palm Beach County, we have emergency medical assistance And they, besides being the funding source, God bless them, they also have a part of it called Emma's Angels. And I would certainly advise or suggest anybody's interested in really doing some hands-on help. So Emma's Angels would reply to, let's say, somebody coming in from another state and has to bring their children, and they provide, they drop off coloring books and some toys and even gift cards for some food for some of the very limited funds that the patients have. And it's a very big help. I do want to just take 1 minute to, having just come home from a national conference, to tell you what some of the other states that are doing, and I'll be very short, that have been very creative. And I'm very proud that one of the women that are at the helm was somebody that worked with us for a long time. But they have mobile vans that are equipped to do not only medical abortions, but MVAs, which is manual evacuations. And they are going to a lot of the border states to actually provide services. A lot of the clinics are expanding, as you said, their telehealth and mailing medication for the abortions, which has, for some states, the laws are just so easy, and there aren't any laws. And many people have been looking to expand their facilities and go into other states that will probably see the majority of abortions if Roe is overturned, such as Illinois will be one of the safest and easiest access to states. So support your local abortion providers, become involved with clinics in your area, and all of you have such heart in participating in this, and it's so appreciated. And we all need to band together at this time and do whatever we can all the time.
Thank you, Norma. I just want to give a personal thank you to our dedicated and passionate speakers. I think you've given us a lot to think about, and I hope you've motivated everyone, all 157 of us on the call at the moment, to get out there and do something to help keep the progress we've made. So thank you. I'll turn it back to Jennifer now.
Thank you. Yeah, and again, thank you to the panelists for your time and for your wisdom, and to Linda and Tara and Meredith. Before everyone jumps off, I just wanted to say thank you all for being here. JWF did create a Protect Roe emergency fund so that we can raise money to support reproductive rights advocacy work throughout the state of Florida. So if you are interested in supporting that or learning more about us, you can go to jwfpalmbeach.org. There will be a follow-up for everyone who registered for today, and we will include links to many of the resources that were mentioned, and including action items for those of you who really want, to use your voice and do something. So again, thank you so much for being here today. This is recorded, and so I will also share the recording with everyone. Please try not to despair. I know that it's hard, but despair is not a strategy, and we are going to do everything that we can to push back on this. So please stay safe, and we hope to see you again soon. Thank you.
Thank you.